kita, di tubuh kita, tinggi nilainya tidak terkira. Selama hidup manfaatkanlah, setelah pergi usah dipersia.
Ada jantung lemah berdegupan, ada mata kabut pemandangan, ada hati sangat mengharapkan pengorbananmu, insan budiman.
Bila tiada lagi darah mengalir, kehidupan kita turut berakhir. Namun walaupun diri telah tiada, pengorbananmu tetap berjasa. Tiap anggota di tubuh kita, tinggi nilainya tidak terkira. Ada hati sangat mengharapkan pengorbananmu, insan budiman. Ada jantung ini berdegup semula, kian jelas kini pandangnya mata. Terima kasih buat insan budiman, pengorbanan budi tetap.
Ini kita cuba untuk try untuk troubleshoot this problem. Buat saya nervous sikit. Minta maaf Prof. Hi Prof.
Hello.
Dr. Hasdy.
Yeah.
Good afternoon. Good evening, sorry. So today kita ada bersama dengan kita Dr. Hasdy Haron dan juga Profesor Dr. Soaik from UMMC. I will try to introduce our speakers, two speakers, which is very serious in the body and organ transplant in Malaysia. So first, we're going to introduce you to Professor Dr. Soaik first. He actually is the director on Silent Mentor Malaysia in UMMC. He also Ketua Jabatan Pediatrik di UMMC juga. Salam, minta maaf Prof. Boleh perkenalkan sepasang. And Dr. Hasdy Haron is actually our Vice Head Department of National Transplant Resource Center. So he's actually very prominent in NTRC, and he's actually in charge on the organ transplantation in Malaysia as person. So first, Prof, can you actually introduce yourself first?
Okay. So I'm actually currently the orthopedic surgeon in UMMC, Department of Orthopedic Surgery. At the same time, I am the director for Silent Mentor Program, which is a form of a body donation program, which we started here in 2001 too. I hope to be able to introduce to you this program and how it had helped to train our medical doctors in this country.
Okay, thank you, Dr. Hasdy, Haron.
Hi, thank you, Halim. Thanks for the nice introduction to both of us. Welcome to Professor to our program here. Today, I am actually a clinical manager for transplant procurement, organ donation in our country, cadaveric donation, disease donation. So, like like Halim mentioned just now, that NTRC is the department or organization that mainly involved with the organ and tissue donation in our country, particularly the disease donation. Okay.
Okay, Dr. Hasdy, thank you for the introduction, brief introduction. Today, we actually, the topic today that has given to us is body and organ donation. Is it possible? That is the topic that we have received for today. Then, specific is silent mentor. The body and organ donation transplant is possible. Silent mentor. So today we brought you a very special guest from the one who actually handled itself, the silent mentor, which is Professor Dr. Soai, which is actually a director on the UMMC, what we call that one, the silent mentor program. So first of all, we actually want to hear from the professor, what is actually about this silent mentor program, and can you actually brief us on specific on body and organ transplant?
Body donation basically is a voluntary program where patients or the public, they surrender their body for the university for teaching and for research purposes. So it is basically contributing to the public in the indirect way, because organ and tissue donation, you helped a patient or a few patients at the same time. But for body donation, you are helped to train doctors. And these doctors, when they learn something new, during the rest of their career, they are able to help many patients. So it is a different way of helping the community in the medical field. So that's why we call Silent Mentor Program.
Okay, Prof, can you actually tell us on the what we call the body and organ donation program? So how we from public want to know about this and how to get to know about?
I prepared a presentation. Would you like to slide on the presentation, because then I can share with some graphics, so easier for everyone to understand?
Sure, absolutely.
Okay. So can you just help me to share to the slides? Then I think I can explain better with some photographs and some drawings.
So, Prof, can you actually share the screen?
Okay. Okay.
All right.
So you can see the full screen now, right?
Yes,
yeah.
we can see.
Okay. So just now, thank you for the introduction. So I will try to... Okay. I will try to use a few slides to introduce organ and tissue donation, and then try to answer the question, whether you can pledge for more programs or whether you can donate for more than one programs. And most of the presentation is to introduce everyone to this body donation program for education and research. We are using the Silent Mentor as a model. Now, what is organ donation? I think most of you are familiar. This is from the form and in KKM on the web page. Kidney, heart, liver, and lungs. These are the commonly harvested organs in this country. And then there are usually two types of donors. One is living donor. A person can donate one of the two kidneys or a small part of the liver, and he can still be alive. But then another form more commonly used is cadaveric donor, when a person is brain dead. And then generally, these are still patients who are healthy with no chronic illnesses, and they are relatively young, probably 20s or 30s and onwards. So these are cadaveric donors when they have brain dead and they are going to die soon. Now, tissue donations, on the other hand, this again in the same form that we can get eyes like cornea, bones, skin, and sometimes heart valves as well. Now, for tissue donation, the requirement is a bit different. Tissue donations, you cannot have living donors. Usually you donate your eyes, your tissues. Usually it is a cadaveric donation. Now, the requirement, age, and general health status for the donors usually less stringent. For example, cornea transplant, cornea donation. If you have a cancer of your abdomen on your chest, you still can donate. There is no real upper age limit, 40, 50, sometimes 60, it is still possible your cornea can be donated. So that's why some of a body donation, yeah, they already pass away at home, bring to hospital, still the tissue can be donated. So now the problem with organ or tissue donation in this country, there are many, yeah, awareness is not so strong, and there are some tradition, culture, religious concern, facilities and human resources, and also organizations. Now, these are the two resources that we can get from KKM and also the resource center. So this one, Dr. Hasdy will be able to share with you more information on this. Now, coming to the question, can you pledge to donate your organ, your tissue, and your body at the same time? Pledge means a formal promise. It is a promise. It's not a contract and it is not an agreement. So anyone, you can pledge for any or all of these programs. Usually organ and tissue, as you see the KKM, the form is in the same form. You can pledge and you usually pledge together. Body donation is a different form, but you can pledge all three at the same time. But then if you come to a situation where you died and you are able to donate for all three, in that case, life-saving organ donation is usually the priority. Yeah, that will take priority first, and tissue as well as organ usually comes together, right? Actually, this scenario, many people asking us, can I donate for all three? Basically, we pledge, yeah? But when the time comes when you donate, the scenario is usually quite different. Scenario one, for example, for organ donation or tissue donation, these are relatively young and healthy people, and they have brain dead due to severe road traffic accident or bleeding on the brain and so on, 20, 30 years old. Whereas our body donation, scenario number two, yeah, is totally different. They are usually elderly people, they have chronic diseases, many of them has terminal illness like cancer and so on. And from our 100 over body donors over the last 8 years, the average age of our body donors is between 65 to 70 years old. So it's totally different. And when the time comes, if you pass away and then you're ready to donate, usually it's not common you can donate for both sides. You are either suitable for one or suitable for the other. Now, what is this body donation for education and research? Traditionally, how people learn medicine, okay? Traditionally, it's like apprenticeship, like you learn Kung Fu, yeah, from your master or Sifu, all right? You start by maybe cleaning the floor, cooking for your masters, then 1 year teach you 10%, next year teach you 10%. At the end, the master teach you 90%, 10% they never teach. But then nowadays, modern medical training is different. Yeah, you have classes, students, and so on. Now, these are some pictures of classes, but this is learning magic. Yeah, learning magic also, like Harry Potter, they have classes. So medical studies also, you have classes like that. Now, the thing is, medical education, you have three main components of training. You want to give your medical students knowledge, yeah? Knowledge. Now, knowledge is easy. Last time you have books, you have library. Now with internet, you can have the whole library in your mobile phone. Yeah, it is easily accessible. Second thing is skill training. Now, that is a bit difficult. How to learn surgical skill. Traditionally, you learn through these methods. First, junior doctors, you observe the master surgeons operating. After some time, you will assist, yeah, pulling the retractor or just holding the suction and so on. After some time, you were allowed to perform assisting by the surgeon. Then, when you're confident, you can do the operation alone. Now, This opportunity is not easy to come by, right? There are so many doctors and there are very few surgeons and not so many patients to learn from. And to learn from, let's say, dead bodies, cadaveric corpses, is very expensive. Hardly junior doctors have a chance to learn. These are for advanced surgery, special advanced master's cases that you use cadaveric, use the human body to learn. Now, this is the initial, some classes that we have. A surgeon want to perform an appendicectomy for our cadaver from one of our mentors. Yeah, the students are so keen to listen and to see, not enough place and so on. So after that, we reorganize the training session. Every demonstration, only 4 or 5 people can see. So now we are organizing in a better form. Now, learning from human bodies is not new. Roman, the Greeks has been doing that. Now, who is this person? Leonardo da Vinci. So he is a painter, artist, but he is also a scientist. Now, he learned a lot by studying on human body. This is his drawing. If he decided not to paint and become a doctor, he will probably be a very famous doctor. Now, on the 18th century, many doctors in UK and Europe, they have to get human bodies to learn from. At that time, many graves looks like this, and it is to prevent people from stealing the bodies. Now, some tombstone, there is a big heavy stone to cover. Now you know why they use heavy stones, prevent people from stealing. 19th century, medical students have to pay for dead bodies, and there are some people who provide this, get a lot of money, become very famous and very rich until the police found out and they got caught and then they were punished. Now, last century, that means during the time that we are in medical school, it is very difficult to get human bodies to learn from. Yeah, usually we get from either unknown or sometimes unclaimed bodies. There are people who are known, but they don't have any relative and so on. So they pledge themselves to the medical school. So they actually volunteered to body themselves. Some families, in some countries, the families are too poor to organize burial. So they just, for that reason, donate the body. Or in some country, as I said, some advanced training courses, they use body parts, they import from other parts of the world, expensive, you don't know where they come from. So these are very ideal and it's very expensive. So it is not freely available for our doctors to learn from. Now, body donation program is a voluntarily, it's a patient or person, they volunteered, they donate when they pass away for doctors to learn from. In fact, although it is not easy to come by, there are countries where the body donation program is very popular. For example, our neighbor like Thailand. Now, last year I attended the cremation ceremony for only one university, Chiang Mai University. The cremation ceremony is attended by their deputy dean, head of departments, and so on. They have 500 donors for one university for 1 year, 2019. So it is a way of life and they are very willing to donate when they pass away. Now, it is actually been published and the world knows about this experience in Thailand. The only thing is, yes, they actually treat their donors with gratitude, but they don't really know when they are operating or when they are learning who they are learning from. They don't know the body who they are, although they treat it with respect. So this is just like you're reading a very good book. You know, you learn, you experience what is written, but you don't know who is the author, who wrote that book. It's a pity you do not know how to appreciate the author themselves. Western countries like Australia, US, and Canada, they also have voluntary body donation program. This is just part of the something you can get from the website. And annually, they do have a memorial ceremony where the students or surgeons will meet with the family and so on. But during the time they learn, they do not know who they are operating on. So that is the characteristic of the current voluntary human, what we call body donation program. Now, what is silent mentor program? For silent mentor program, it is a form of body donation program. The difference is the surgeons, students, or researchers, they have to know their donors, and they have to know them as their teacher. There's a guideline. You have to perform your learning with respect. You have to express your gratitude, and you have to know them as if they are your life patients. Yeah. So the basic requirement, you have to know your donor, because you cannot treat a patient like your life patient where you don't know their name, don't know they are coming from. You have to know them, especially you are considering them as your teacher. Now, silent mentor program was initiated by Tzu Chi University in Taiwan, 1998, when they started their medical school. They are using a chemical preservation for anatomy teaching at that time. In 2002, Tzu Chi University, they initiated this freezing preservation. Yeah, that means it preserves the body under low temperature. Now, freezing temperature, you can actually use the body for learning only for a short period of time, maybe 3 or 4 days, but the consistency is good for you to learn surgery. Now, 10 years after that, 2012, University Malaya, we initiated the silent mentor program, learning from the Tzu Chi experience, and we are only adopting the freezing method. At the moment, we have not been using the chemical preservation. So this is a Tzu Chi University from eastern part of Taiwan. And this is in 2012. Yeah? We signed an MOU between UM and Tzu Chi University, and we started our silent mentor program over here. Currently, this is a team of my board of directors, and nearly all of them are volunteers, clinicians, and also researchers. Now, following our adoption, other countries have also started. Yeah, after 2012, Hong Kong, Singapore, and the latest in Myanmar, they have also started silent mentor program. In fact, Myanmar invited us to go over there and to observe their initiation. Now, in Malaysia, there is more than University Malaya. There is an Academy of Silent Mentor organized by the private entity. UNIMAS, I heard, has already formed also a silent mentor program in Kuching, and University Science Malaysia in Kota Baru in Kubang Krian is also very interested to start a program over there. Now, a bit about preservation, as I mentioned just now. Yeah, chemical preservation, it is using a formalin you have heard of. Now, using formalin preservation, the body can be kept for many years. So this is good for anatomy learning, because for undergraduate student to learn anatomy, body structure, body parts, the process is about 1 whole year. So using chemical preservation, you can last that long, and then you can learn from head to toe. However, for freezing preservation is different. Yeah, in our centers, we keep between -17 to -30 degrees Celsius. It's not enough just to keep at 0 or -5 degrees Celsius. Although it is frozen, but the decay process is still going on, although it is very slow. But if it is lower than -15 degrees Celsius, the body can be kept basically forever. Now, with this method of preservation, the consistency when you unfrozen it, when it comes to room temperature, the consistency is really like normal human beings. The only difference is it may be still a bit cold, there is no body warmth, there is no bleeding, there is no breathing motion on the chest wall, and the patient would not complain of pain. Other than these 4 factors, everything is really like real patient. So the learning quality is very good. But the limitation is it can be used only for 4 to maybe 5 days the most. Then we have to subject for cremation. Okay, now I would like to introduce you a bit about the learning program that we do. Yeah, so we have 1 week. We organize about 4 training sessions a year, and each training sessions, generally we say 1 week, but actual learning is 4 days only. Now, as we see over here, for the Wednesday, Thursday, and Friday in the evening, that is a learning time for medical students. Yeah. What do they learn? They learn to perform this procedure for emergency medicine, intubation, chest tube, and insertion of central venous line, and suturing of skin. These are basic skills in medical education. Now, without this, they have to do it on the real patient with anesthesia or sedation. This is not very ideal. This is for Wednesday and Thursday. We divided into 2 groups. And on Friday, we go for demonstration. We asked special experts, surgeons, orthopedic surgeons, ONG, and all, to demonstrate. Among these are some of the common procedure. So they don't do it, but they see how it was done, and they will touch, they will feel the structure, the wounds, and the way how the surgery has been done. They see them firsthand. Now, this is actually something to be shared by Dr. Rashida, anatomy lecturer of University Malaya.
I am Dr. Rashida Muhammad Zamin from Department of Anatomy, Faculty of Medicine, University of Malaya. It's been a great opportunity for me to explore more on what I've been teaching for the past 5 years, basically, because we've been using only preserved specimen for the past 10 to 20 years, and this is like my first time handling extra fresh specimen. I will not call it specimen now that I know them quite closely, my mentor. So yeah, I feel very honored to be given this opportunity, and I've learned a lot through this experience because I can feel the compassion, and also it makes my learning experience more meaningful.
Okay, now these are some of the demonstration by orthopedic surgeon, general surgeon, ONG, and also now the students, as you see, they wear gowns, and the one in green are surgeons. Yeah, these are surgeons coming evening voluntarily to teach. And you can also see some of the people who are actually not wearing the operating gown. These are year 1, year 2 medical students. They volunteer to come to help, to provide, to clean the area and so on, because at the same time, they can learn as well. You can see the keenness of these young students and young doctors, to learn from the silent mentors. Now, in addition to this, during the daytime, Wednesday, Thursday, or Friday, we use these to train surgical skill for subspecialty. So this is a specialty for orthopedic surgeon. Now the surgeons are performing silent prayers before they start the procedure to show their respect to their mentors. So we can actually demonstrate how the procedure is being done before they perform it on the mentors, a learning program for the surgeons. And this is actually a trainer from US. He came here for a special conference, and he was invited to demonstrate and to teach our local doctors some advanced steps of surgical intervention. Now, this is on Saturday. This is for the time our doctors to learn basic skills again, not medical students, but doctors. So these are orthopedic procedures, working on 2 of the knees, and anesthesiology, ophthalmology, and general surgery. So you see there are many groups of people learning from this. Since 2012, when we started until now, 8 years, we have already organized 30 sessions, 30 weeks of training. We have used 118 mentors so far, more than 100, and about 1,000 medical students have been trained. Now, 2 years ago, we opened medical students to all those from other medical schools in the country, because we have only about 120 medical students in University Malaya. We also started some research projects. And last year, we start to do some research on our medical students and the family members to see whether the impact, whether there is a positive outcome from this program. The result is not published yet. It is still ongoing. Now, just look at 1 year, last year, 2019. So professional courses for experts. Now we have 77 surgeons from different fields learn from experts, and you see there are 38 foreign participants. When you have experts from US, Europe, and other parts of the world coming over, we don't want to restrain their learning only for Malaysians. Surgeons from Singapore, from Thailand can also come and join us. This is for hospital doctors. About 105 our hospital doctors learn from silent mentors. For undergraduate, now last year, 141 medical students, some not from UM, benefited, and these are the research activities that we have done. Now, although the session is only 1 week, actually the training is only for 1 day, but the organization of silent mentor program is much more than that. Now, I just want to share with you what is being done to arrange or organize for this. Many things. Now, we just go again, started with home visit. This home visit starts before even the week, 1 or 2 months earlier. Now, the students visit the families. This one is Jarantu. We arrange a bus to bring all of them because they need to know the family of this mentor, where they come from, to appreciate why these people, why finally they decided to donate their body. They are not patients of this hospital. They've never been to the hospital before sometimes, but they just allowed their body to come over for learning. And sometimes you have to learn from the senior. These are the parents of the donors, or sometimes the grandchildren from the donors. First-hand message or information from them. Sometimes the house is too small, we have to do outside, or sometimes there are too many families, the house cannot accommodate. So we do our interview outside of the house. Now, because of COVID, this is last week, so we have to modify the home visit program. So we use this online method. So you see the students are online, and then the family sitting on the table. Now the students can also see them. Now these are the family. So we do online home visit, yeah, because of the COVID-19. Subsequently, I think we still do not have the slides of all this modification, but we are modifying the program, the photograph that we show are from our previous sessions. Now, after the home visit, coming to this 1 week, it starts with the thawing on the Sunday. Thawing means bringing the bodies out of the cold room. So the students have to clean this and bring the bodies out. These are their teachers, right? So you have to manage their teachers or mentors with respect, bring them to anatomy room, and it takes 2.5 days to return to normal body, near normal body temperature. Now, after that, for the Wednesday, Thursday, Friday, Saturday, the students have to take care of their mentors every day, starting with day 1. You have to clean the body, and for the men, we have to shave the beard sometimes, and then at the end of the day, they have to make sure all the wounds are being closed. Again, they have to manage these mentors as if they are live patients. So every day when there is a specialist groups come in, the students have to introduce their teachers to them, because the students will be with the mentors throughout the week, but these specialists are coming maybe for 1 workshop or maybe 2 workshops. So they come, they have to know their mentors, and then they work and learn from them. So now for the training session we have gone through, but then the ceremony before the actual training session, Wednesday morning, we call that there is an initiation ceremony. So this is where all the students and the family members are gathered together. There is a short ceremony based on the religion of individual mentors, about 10 to 15 minutes. And then the families are allowed to meet their loved ones for the last time. So these are the ceremony that lasts before 8 o'clock, where the workshop will formally start. So the 4 days of workshop will carry on until Saturday evening. Workshop stop. Then the next ceremony is a coffining ceremony. Again, this is organized by the students. Their teachers are going to rest for from now onwards. So there is a formal ceremony that we are organizing, and it is all recorded in video and pictures. The family are not involved in this ceremony, but from the pictures, they would know what is being done to their family members. So after this, it is on the Sunday where we go on for the gratitude ceremony. Now, gratitude ceremony used to be open to the public. This is when the students will again introduce individual mentors to the public. Some come for the first time, and we encourage them to perform using some presentation to show their appreciation to their family members. Sometimes we allow the family members to come up and share what they feel after they see all that this training has been gone through. Gratitude ceremony I'd go on, and it was immediately followed by the sending off. This is also at the Faculty of Medicine, University Malaya, near the Dean's office. So we will follow the family members to have a sending off for about 1 kilometer from the Faculty of Medicine until the first college over there. And from there, we'll take bus to the crematorium. This is the last journey by the mentors, and the students will join the family members to follow the cars. So from there, we proceed to the crematorium. This is a very simple ceremony of sending flowers, and that will conclude the ceremony for the last day. Now, at the end of these heavy days, usually we are very tired, but again, the group become very close because there is a significant bonding during these 4 or 5 days. And more importantly, not shown in the pictures, the family members are usually quite close with the 9 or 10 students who take care of their loved ones throughout this period of time. Now, what is the future plan of our Silent Mentor program? We are hoping to get more medical students from other institutions. We know Malaysia, we train about 5,000 medical students every year to become doctors. We are now only allowed training for 140 medical students, so there is still a long way to go. We already procured more freezers, and we hope we can get more donors, and it will benefit more students. So currently, these are among students coming from these medical schools for our program. And this is, I think, something is reported by Pranama 2 years ago about the program.
Perubatan, Silent Mentor adalah medium pelajaran yang paling baik untuk pelajar perubatan walaupun tiada interaksi verbal antara mereka. Muzammil Muhammad Musa, pelajar perubatan Universiti Malaya berkata, proses pembelajaran bersama Silent Mentor adalah pengalaman berbeza berbanding mempelajari anatomi manusia daripada buku elektronik dan simulasi berkomputer.
Selflessness is also important, to be able to feel what the patient is feeling, to be able to understand what they're going through in their hardships, to be able to care for them and to put them before you, because being a doctor requires a lot of sacrifice, of time and energy. So being selfless for Silent Mentors have really taught us what it means to be selfless.
Bagi Gladys Lim Fong Lian, isteri kepada salah seorang Silent Mentor, Stephen Ong Hiam Ai, mereka sekeluarga bangga dengan tindakan suaminya yang sedia memberi sumbangan kepada penyelidikan dan pendidikan perubatan.
I was very impressed. To me, it's not because of easy work, you see, for us to serve the departed one, but it is a scientific program that is very useful to society. I always believe that you go to university to learn is only on technical things. Everything is. What you need is hands-on, practical, the realistic in life.
Okay, this is another, I think, documentary. This is shown across the world by this Thai television channel, which is a global channel.
I remember there was a Silent Mentor who once said that he would like the medical students to make mistakes while making incisions on him, not on real patients. Thanks to the Silent Mentor, I had the courage to make that incision. I might not have the courage to do so on someone I don't know.
Okay, so the second thing is we would like to get more volunteers to teach the students. So as you can see, these are the list of volunteers on our homepage. So some of them are professors and some of them are famous private surgeons in the private hospital. They just volunteer their time in the evening to teach very basic skill like suturing the skin and so on to future doctors. We hope to collaborate with more professional bodies or societies to organize advanced workshop. This is just among some of these. So they usually have a conference, they bring speakers or experts from all over the world, and we can try to tap this expertise, ask them to train or to teach our local doctors this advanced surgery. And these are among some of the procedures that we can learn advanced using an ultrasound, using scope or microscope for operating procedures. And this is orthopedic arthroscopy and ENT station at the same time to maximize the training or learning output. This is our Deputy Director for our Silent Mentor Program, Professor Izwan. He also actively involved in training for emergency medicine.
I have started the training for the emergency medicine doctors in Universiti Malaya Medical Center, as well as the Master Student of Emergency Medicine of Universiti of Malaya, using the Silent Mentor Program. We have created workshops mainly targeting trauma-related procedures and also airway procedures.
So finally, we hope to conduct more research projects using our mentors. So these are some of the research activities that we do. At the bottom left there, Professor Raja Amin doing cardiothoracic surgery to look at the cancer of the lungs, and the right side, the pathology is getting the tissue samples to analyze for tumor cases. So in summary, organ, tissue, and body donation programs provide ways for the public to contribute toward the well-being of others when they leave this world. It contributes in the different way, whether to help patients or a few patients at the same time, or to help the doctors to treat more patients effectively. Arranging for these contributions require collaboration with the public, medical health authorities, and voluntary bodies. Now, this is something that we mostly hope to achieve. We try to promote humanistic values among the young medical doctors who will practice medicine with compassion and empathy. Many times people help us, how will you know that the doctors, after going through the program, they will become a compassionate empathy doctor? I know it is very difficult. We do not have proof, but if there is a question thrown to me, I have an answer to them. When we as a trainer or we as a learner themselves in front with this mentor, although the mentors do not speak to us, but the message passing to us is very loud and clear. They are not our patients. I don't know them. They don't know us. But the fact that they are there, they are telling us, learn from me. And this message passing to us, it will give impact to our heart. Then if they can teach, they can reach our heart, we believe it will reach the heart of our medical students as well. Now, it is difficult for me to share with you this environment when we are there, but I would like to share with you a video clip where we talked to a mentor before he passed away. We told him, when you pass away, your body is going to be operated by students. If you have a chance to talk to them, what you want to tell them. So this message was recorded, and this is a message, even they don't say, we understand. I just want to share with you and then let you judge for yourself. Is there any impact that you can feel?
I hope the students were taking advantage and learning from my body. If they make the mistake to it, don't worry about it. I don't feel any more pain. Just redo again until you can perfect it so that you won't make the same mistake on a living thing. So make sure that every time when you make the incision or cut on my body, don't ever worry that I'll be painful And don't ever worry that I will have any grudge for you, because I'm not around anymore.
Just actually before I want to proceed on my topic, I actually wanted to ask Prof.
Yes.
For your, it's very excellent presentation. I am very happy to see that this program, Silent Mentor program, has expanding so much from the last time I saw your previous presentation. And I just want to know whether there is any specific selection criteria for anyone to become a body donor.
Okay, thank you for that question. Basically, as I said, the body donation, the selection is less stringent. In the form, donation form, they are listed down. So patient with infectious disease, there's WHO listed like HIV, hepatitis, chikungunya. There are quite a number of infectious disease. So those ones we do not include. Then we also will need patients who have a burial permit. So cases that are under, let's say, road traffic accident and so on, it will need to be investigated, post-mortem, and those type of donors we will not be able to accept. So most of the patients that we have are those who pass away from chronic illnesses, stroke, medical problems, or even cancers. Yeah. So these are generally the more elderly patient, although we do have patients at 30-something, 40 years old, but usually they have chronic illnesses and pass away due to the chronic illnesses. We consider that as a natural diseases rather than accident and so on.
Sure. Thank you, Prof. Okay, now back to what Halim asked just now. Okay, so basically organ donation, I think Prof saw already in early of his presentation, he mentioned brief about organ donation and tissue donation. So similarly with donation, both of these program actually contribute to what we can offer when we passing on or away. So yeah, so the thing is organ donation program and tissue donation has started as early as 1975, but of course during that time it was only started with the living donation and transplant. Between of the what can be donated during living, which is a kidney donation. And I think we started to, and subsequently after 1975, we had one case of deceased donation in 1976. But it was not a full program of like what we had now, which is the National Transplant Resource Center. So in 1997 that we started to develop a program for the cadaveric donation and deceased donation. And now that, although that we have started very much early, since 1997, but until today, we only have a very few numbers of organ and tissue donors. This is what was told by Prof just now. So it's our concern to say that actually numbers of people who donating, has donated or even wanted to donate organ and tissue is very, very less. Whereas our demand or the demand for patient for transplant is a huge in number, all right, particularly for the kidney patient. So I can say that we only have about 733 organ and tissue donor since the program started 1997. So where we have about 5,000 to 6,000 numbers of people who's waiting for the organs, and but the numbers of that people actually who has donate is less than 1,000. So now in order for us to increase the numbers, we have actually we have done a lot of programs, a lot of awareness program, particularly from our Educational and Promotion Department in NTRC. Miss Encik Halim is one of the officer who actually responsible for awareness program. So that's what we have. We have a pledger or donor register system, a pledge system. So anyone can register to become organ and tissue donor, and I think we have about 470,000 of Malaysian who actually has registered to become organ and tissue donor. So to register as an organ and tissue donor, we don't need to actually going through some medical checkup. Everyone can actually pledge or register. Only that if you are below 18 years old, that you need permission from your caretaker, from your nurse. So as you all know that in organ and tissue donation in Malaysia, we are under the Human Tissue Act, which actually we practice opting-in system where the donor has to express the wish to donate, and the consent will be taken with the next of kin who's still alive. So of course, when you register or you pledge, you have to inform your family members, so that when the process of we approach the family members to get the consent for donation, so the family members is aware of our intention, of our interest to become donor or not. So most of the organs that category organ that donate, most organs used for donation and transplant is actually kidney donation, followed by liver donation, and very few of heart and lung donation. And tissues, since that we can procure or retrieve tissue for both of brain death and cardiac death, so the numbers of tissues is huge that can be donated, which is a cornea donation and bone donation, as well as a few of heart valve donation and skin donation. So we have a few of challenge why actually the numbers is very, very low, which I have to agree also what Prof mentioned just now, that among others is actually the awareness among people are not so strong. There is, I think that now that people heard about organ donation, but maybe they are not very much understand what is the process involved, how actually organ and tissue donation been done. Particularly we talk about disease or cadaveric donation. So basically, if we have a potential good organ and tissue donor in the hospital, most of our organ donor is coming from a brain dead donor, a patient who died of very brain death caused by by the traumatic brain injury or accident, road traffic accident, or spontaneous bleeding in the brain, stroke, can cause patient to become brain dead. So this is a type of patient that we can actually getting the organs to be donated and used for transplant. And so the numbers occurrence of brain death is not high, it's low. That one of the reason also. And when most of according to our data that shows that most of family members actually refuse to donate organs and tissue. Sometimes it's because there is no consensus among the family members, meaning that in our structure of family in our country, that we need to get consent agreed by all of the family members. So when there is no agreement or consensus among the families, we cannot proceed to actually getting the final decision for organ donation. That's one of the challenge we're getting. So of course, there's some other factors that contributing, like religious factor and culture factor. But what can we observe as well, that we need more of our healthcare professional to be aware of this program, because this can happen anytime and at any hospital and any wards or any wherever the patient will be in. Most of the time, of course, in the ICUs, but it can be in the other ward as well. So healthcare professional actually plays a very vital role in actually approaching the family members to getting the consent for organ and tissue donation. So we can see the effectiveness of this healthcare professional in other developed countries such as in Spain, in Australia, even in Iran. So we can see one of the reason they actually have a good numbers of donor because their healthcare professional are together play the roles to actually be the main person to get the consent from the family members. So now we have a pandemic. So yeah, it's very interesting to know what is the activity of organ donation and transplant is how we do it in the current situation of the pandemic. Well, since COVID-19 started early of this year, and I think we have underwent a few of lockdown series. I mean, in our Malaysian situation, the program of we have to adjust or to make our SOPs or guidelines for organ and tissue donation to be safe in according for the pattern of the new virus. So definitely all patients who wanted to become our donor will have to screen for the COVID-19. And of course, there is some other risk factor and or additional history that we need to evaluate from our donor, whether there is a travel history, a contact with the COVID-19 patient and all, and whether what is the final diagnosis when patient actually diagnosed as a brain death, which after that we screen everything, whether the patient will be safe for transplant, then later we can proceed to take the organs or tissue. So in that case, with the stringent of procedure, numbers of donation actually has quite early during the March and until June. Actually, we stopped doing the donation, and then after that, when
not accept as a body donor. However, the other way is a bit different. Only last year, we discussed with the ophthalmology, we noted that for body donor, when they must reach our mentor center in about 8 hours, actually the cornea can still be donated. So we are now trying to start for our body donors. If we know them early, we may actually tell them, if you wish the cornea, it is possible you can donate your cornea, then it can be transmitted to healthy living human beings. So this is something that body donor can donate tissue, because cornea, 8 hours after you die or you pass away at home, you come to our center within 8 hours, the cornea is still usable. So this is, I think, the current scenario. So another question I think wrote down in the notes there is just to confirm, when you have organ, tissue and body donor pledge, if there is a case needed, organ always comes first. Yes, it is absolutely correct, because organ donor, you can actually help or save life of a few people. There's one question, interesting question on whether Muslims are allowed to donate. In fact, a few years ago, there is the USIM, University Science Islam Malaysia. They have conference on this Muslim perspective of body preservation for research and learning and so on. I was invited to give a talk on silent mentor program and so on. There was some discussion. So currently the understanding is organ donation and tissue donation, I think in Muslims now is sort of allowed, and there are cases happening. But for body donation, because of a requirement to burial and all, so it is not compatible yet. So far, we do not have any Muslim pledges or donors because of the interpretation of the religion is in this way. So we do not accept Muslim donors at this moment. There is one last question on how to get the forms. So the forms for body donation can be get from our homepage. You just go Silent Mentor Program, UM, or University Malaya. You have our homepage and the form you can download from there, fill in and send to us. Now there are one thing a bit different is that we need the pledger, the person to sign. But the thing is when you pass away, you cannot, no matter how keen, you depends on your person or family, just like Dr. Hasdy mentioned just now. So we need 2 trustees, 2 family members, not 1. Yeah, because when you pass away, the person who is taking care of you have to pick up the phone. Yeah, so for organ donor, you probably have an accident or what, you come in the hospital, you are in the hospital, yeah, you cannot run away, then there are already some process going on. But for body donor, you're at home, you are terminally ill, you have cancer and so on, you pass away at home. So it will depend on your relative to pick up the phone to call us. If they don't call, then it will not happen. So we need 2 trustee, 2 family members to sign before we give you the pledger. So I think maybe for organ donation, you have to consider something like that. The family members is very important. I heard that for all the pledgers, potentially possible organ donation, more than half of the cases, the family, oh, I don't know about this, or I feel not and refused, so it cannot be done. So it's a pity.
All right, thank you so much, Prof. Dr. Soaid, for giving your time with us. And thank you, Dr. Hasdy. I think this, session is very fruitful and we need to do in a short period of time. I think we are not, cannot take, I think we need to have a longer time to tell about this. So I think maybe not today. I'm going to continue in the future with you, and hopefully that we're going to do every time, so the next year and all. And we also are very happy if you give us invitation to come to your symposium. All right, thank you, Prof.
Okay.
Thank you, Prof.
Thank you.
Thank you.
Tiap anggota di tubuh kita tinggi nilainya tidak terkira. Selama hidup manfaatkanlah, setelah pergi usah dipersia.
Ada jantung lemah berdegupan, ada mata kabut pemandangan, ada hati sangat mengharapkan pengorbananmu, insan budiman.
Bila tiada lagi darah mengalir, kehidupan kita turut berakhir. Namun walaupun diri telah tiada, pengorbananmu tetap berjasa. Tiap anggota di tubuh kita tinggi nilainya tidak terkira. Ada hati sangat mengharapkan pengorbananmu, insan budiman.